Okay, welcome back. And again, we're here with Sherri Moore and Laura Duguid, and we're talking about stress incontinence and pelvic floor. So the next thing we're going to get into is male incontinence, which again, I had no idea was such a big issue. So what kind of numbers are we looking at? Like how many men is this affecting?
Well, it's actually 1 in 7 men, and a lot of times it actually has to do with their prostate. So if they're having a prostate issue, be it cancer, enlarged prostate, that interferes with their incontinence, and then they get into a lot of problems after they have some rehabilitation around that, and then that's why we're seeing them.
Okay, so now again, and I do recommend that men definitely get regular screenings for prostate.
Yeah.
Because prostate cancer is an issue that we all need to be looking at. Don't be afraid, gentlemen, to go to the doctor, okay? It doesn't mean you're not tough. It means that you're taking care of yourself, okay? Now, what are the kind of symptoms that a male, would it be any different than a female? Would it be more potent, or would it be, more volume? I don't know.
No, it's actually usually less volume. So it's more of like a drip, or like it's more just a wetness, versus a woman would have more like a spurt of loss. So it's a little different in that sense. Or they just constantly drip, 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 drip is what they'll often have. Okay,
now could this be brought on from lifting as well, like the same way that women could be? So if a male was lifting very heavy, could that affect them as well as we were talking about women as well?
Yeah, for sure, because it's a whole pressure system. So if there's a loss of pressure, creates leakage. Just like a disc herniation can happen, just like anything that we don't control our pressure properly, all of a sudden we could get increase of reflux, we can get dripping for urine, we can get back problems, we can get a hernia, things like that, all with not controlling our pressure system properly.
Now again, just to let you people out there know, when we're talking about hernias and abdominal issues, if you feel abdominal pain and something doesn't feel right, you need to seek a doctor's help, because it could limit the damage that's being done, because it can be taken care of very quickly. Now, Laura, we were talking a little bit about when we were doing progressive weight training. So when we were doing progressive weight training, as the weight went heavier, obviously the risk went up. But it was one of those things that when you started to communicate, hey, I have to go to the washroom, okay, this is what's going on, no big deal. Now, what would you say to people that were training with a male trainer and they were female, or even a female and female? Would you say that you felt more comfortable after you said that this was an issue? Or,
yeah, for sure. I think, I mean, we had talked about, some female clients that suddenly didn't want to do certain movements, and, we're friends outside of the gym, so it was easy for me to say, well, this is it. Like, they don't want to leave a puddle on your floor, right? Yeah. So, and I don't think it's ever quite that bad in here, but it feels like that when you're in that moment, right? So, I think if there are trainers out there and they notice that some of their female clients are putting a weight down and maybe giving themselves a second to readjust and then pick it up again, some of those movements, definitely when you're engaging, all of your glutes and your core and your pelvic floor in order to do some of those deadlift movements, that's what you're engaging, right? Is through your hip and your glutes. So for those movements specifically, you're pulling at the same time as you're pushing, right? Yeah. So there's a lot of imbalance there, right, in the pressure. So if it's going to happen, that's when it's going to happen. But being able to say to your trainer, hey, listen, this is a thing. It's, it doesn't have to be normal, but it is common, and have that open dialogue. And, you yourself as a trainer be able to say, well, there are services out there where you can seek help. You can go see Sherri. She's highly recommended by all of my female friends. So for sure, you can definitely go see her and say, hey, listen, this is the problem I'm having. I enjoy working out. I don't want it to spoil that experience, to use my body to its full ability because I have this issue, right?
And again, I want people out there to know that there are support systems for these things. There are people that are specialists. And again, I wasn't aware of the issue. And meeting Sherri, it was great for me to get this information, because as a trainer, I like learning new things. And because it's always a progression, you always have to be learning and changing. And everyone is different, and finding those things that work for one that might not work for another, and finding out things that we can do together to make each other live a happier life and healthier life. Next, we're going to get into a little bit about C-sections, because I know you'd like to have a discussion about that. So we're going to get I'd like you to tell me about some things that you can have happen with C-sections, or myths that would be going on with C-sections, because I know a lot of women think that it's going to reduce the risk of incontinence if they get a C-section. So if you could delve into that for me a little bit, that'd be great.
Yeah, so a lot of people think that if they if they end up having a C-section, that they've preserved their pelvic floor and they don't have to worry about their pelvic floor. But a couple of things they really need to be aware of is that, you know, you've carried the baby for 9 months probably, and that just in itself puts a lot of strain and stress on the pelvic floor. It lengthens the pelvic floor, it makes it less efficient. The other thing is you've probably been in labor for a while before they actually even decided to do a C-section, and that labor put a lot of toll on the pelvic floor. So afterwards, when you have the baby, and even if it was a C-section, don't forget to look at your pelvic floor and take care of it. So, you know, just like any other injury in our body, we would ice it, we would take it, rest it, make sure we rehab it, get the muscles working again, and that type of thing. But what other I see with C-sections is that people don't realize that those muscles are interconnected neurologically with the pelvic floor. So if you turn off those 9 layers that they cut through to get to that baby, and you're changing the dynamics of those tissues, you're actually changing the pelvic floor ability to do a job. So in time, we are starting to see people that have had C-sections have just as many pelvic floor issues as women that haven't had C-sections.
Wow.
So it's important to really examine that. The other piece that we really see with C-sections is that there's a lot of adhesions that come with that. That's 9 layers of tissues that they're going through in order to get to that baby. And that, I will never forget the time I worked on someone's rotator cuff, and I was an orthopedic physio at the time. I wasn't dealing with as much pelvic health at the time. I was starting to, so I always had that kind of thing in my head, thinking about women in that way. And this person had a rotator cuff injury, and I got them rehabilitated to a certain degree, but never got them 100%. I was trying to figure out what was that last piece that I was missing. And I clicked, I went, wait a minute. And people always wonder, why do I ask them about C-sections? Why do I ask them how they're having a baby if I'm working on their finger? I mean, that's because it gives me a lot of information.
It's all that interconnectivity, right?
Right? And so I remember that this person had a C-section. I asked her if I could look at her scar, and I worked on her scar and did some work on the adhesions, and within that one session she had 100% range of her motion. So all of a sudden I took care of this problem that wasn't fully recovered just by simply looking at something down here that was really interconnected up there.
Wow. So was it like, were you increasing the blood flow to that area? Was that what was, or breaking down scar tissue?
It's more about breaking down scar tissue and the ability for those tissues to move the way they should. So even though I'm moving my arm, I have to, all my connective tissue has to move to accommodate for that.
Yes.
So if I have some adhesions down here, that's going to affect things going on elsewhere. And that's what we're seeing is that these, you know, a C-section or, you know, scarring in the pelvic floor area, we're not seeing these problems necessarily creep up in the beginning. We're seeing them creep up 10 years later. Maybe once these kids go off to university, like your daughter heads to university, and all of a sudden now you're getting more active. These women are also like challenging their bodies in the way their bodies aren't ready for.
And I also want to get into that a little bit, because a lot of these things I'm seeing, like with mud runs and these fun runs that a lot of the people are doing, and a lot of these CrossFit things where they're jumping into something very quickly and they haven't had very high activity levels, and then all of a sudden something's happened to them. Could you guys get into a little bit about that, like Sherri specifically, and then we'll get to Laura after that about some other things. But what can you recommend to somebody that wants to do a fun run? Would you say getting into it, do a little bit of warm-up kind of thing, like training, or would you say that there's something that they could look for, like while they're training, that, okay, maybe this isn't a good idea to do it?
Yeah, I mean, that's a big thing, and we see it all around. And those are, I mean, hey, you want to keep me in business, keep doing it.
Yeah, right there.
But we often see people go and do these, you know, fun activities and are hurting themselves. And so, yeah, for sure. I mean, it's important to make sure, like, is your body in good check? Are you able to do that type of run? Because there's always risks with anything like that. So yeah, make sure that you can kind of test out things before you actually go into it.
Mm-hmm. And Laura, for you actually did a different style of training before you came and trained with me. Could you explain like the differences that you found between what you were doing before and what you were doing before and what you're doing now?
Yeah, for sure. So I did a bit more circuit training. So it was more things like some unbalanced work, on, you know, Bosu balls. We did do some lifting. It was a lot of jumping jacks, step ups, that kind of thing, squats. So a lot of those movements, while they were effective and I did lose weight, I also had a lot of issue with my pelvic floor, just based on the fact that my body wasn't really ready to be doing that, right? I didn't have that level of exercise up to the point where I was starting to strengthen all those core, muscles and stabilizing muscles that I needed to do those. So this is definitely just for my body. I know everybody's different, and some people have had no issue with pelvic floor doing that style of training. But for me personally, this style of training just seems to be more effective in strengthening all of my muscle groups and allowing me not to have those same types of issues for sure. And I think a lot of that is attributed to the style and the different movements that we do in terms of, deadlifting, full depth squats. I know that's huge in here. Even our deadlifts, no stiff leg deadlifts. No. We're constantly engaging all of our glutes and our quads and our hamstrings in order to pull the weight off the floor. So we are, down low, butt down, head up, chest up, breathe. That's always repeated. If you ever watch any of our videos,
it's a terrible
thing, right?
mantra that I have a very bad habit of saying.
Yeah.
The head up and chest up and shoulder blades tight.
Right.
And it's almost gotten to so repetitive that it's annoying for most of my clients. I'm well aware of it, but it's reiteration and telling people this is what you need to do.
And it's all those movements too. Like when we squat, if you're not at full depth, you're not doing it. Like it's those, if you don't have that range of motion, and I know when we start, that's what we work on right away, is doing that full range of motion with no weight. So your body is getting used to that movement and it has that flexibility. And I know, Sherri, we were talking about that full depth squat is so important for pelvic health. That a lot of women don't realize they're doing, not a full squat, and they're not getting the benefit of that exercise the way they should be, and they're definitely not helping their pelvic floor by not, hitting that depth. So
now again, I want everybody out there to know, we're not talking about touching your butt to your ankles, okay? Not everyone has that flexibility and range of motion, okay? But we are saying that you need to be breaking that parallel line with your hip and your knee, okay? Now, you can do that safely on several machines in the gym. We have one at Alpha Power and Performance here, the Super Squat, where you can get nice and low and not have any pressure on the knees because of the angle. Now, we were having that discussion. Could you talk to some people, or talk to everybody about why a full depth squat is different than doing, let's say, a quarter squat for women and not having that range?
Yeah, so from my perspective, just thinking of it as a pelvic floor physio, it really has to do with the fact that you engage your pelvic floor in the deep full squat. Mm-hmm. And women don't always have the ability to connect with those muscles, and if they do, they need to be able to connect with them in a functional way. And also now you're doing a deep squat. We know research shows us the pelvic floor kicks in on majority of people.
And thank you guys really much. I'm so glad to have you guys on. I'm so happy that I could get you on for the first day.
Thanks.
That's awesome. Thank you very much, and have a great day, guys.